2 years ago, James was admitted to his local hospital with viral wheeze. During this admission, he deteriorated and was intubated and ventilated and transferred to the paediatric intensive care unit. He has subsequently been well and has not come to hospital with any acute exacerbation over the past 6 months. James has not had any problems with his breathing, so his mum decided to stop giving him his brown inhaler. James has eczema but is otherwise well. He doesn't have any drug allergies and his immunisations are up to date.
Hi, are you James's mum?
Hi, yes, yeah, I am. Sorry, I was just out having some fresh air a minute ago, sorry.
Okay, so I'm Rebecca, I'm one of the nurses, and I've just done a quick assessment on James, and I've just called the doctors to see whether they can come and have a look at James as well.
Okay, is he alright?
Yeah, so he obviously sounds a bit wheezy, so I think we probably need to start some treatment.
Okay, yeah, okay.
Hi Rebecca, you've got a little one for me?
Hi Sam, yeah, this is James, he's 4 years old, and he's just been unwell for the last few days with cold symptoms, and Mum's brought him in today because she felt that he was a bit wheezy. She gave him 2 puffs of the blue inhaler at home and has brought him in. So on the initial assessment, he's got bilateral expiratory wheeze. His SATs were 92 and 93 when he first came in, but we've sat him up and they've stayed about 95%. He has got an increased work of breathing with subcostal and intercostal recession.
Okay, Mum, can you just tell me a little bit about kind of what brought you in and how you think getting worse?
Well, he's been fine like for like the last 6 months or so. So he has like 2 puffs of the blue inhaler like every so often, like basically when he's like doing PE or at home running around with the dogs and that, like he just has it when he needs it basically. That was what the doctor said. And then we ran out of the brown inhaler, and because he's been so well, I just thought like it didn't need it anymore, so we've not been given that anymore. But that's 6 months ago since we've stopped that. And then yeah, because like a few years ago he was like really sick with it, but no, like since then I think he's grown out of it. Like they say that, don't they, that they can grow out of asthma. So I thought he was doing really well.
Okay, I'm just going to have a quick listen to James, if that's okay.
Am I alright?
Yeah, that's fine, yeah, you stay just there. Hi James, I'm Sam, one of the doctors. I'm just going to have a quick listen to your chest, okay? Yeah, Rebecca, I agree with your assessment. He is quite wheezy and he is working quite hard. So yeah, I think you're right, we should probably do some burst therapy with an inhaler, and probably give him some oral steroids as well.
Okay, perfect.
Great, I'll go and prescribe that now.
Thank you. Hi, we're going to give the burst therapy with the salbutamol first and the Atrovent, and then I've got the oral steroid to give him as well. We'll give the burst therapy first. Would you like to give it? So just check the technique.
Yeah. Okay. Come on, James. You're going to sit up and do your inhaler now. Ready?